Hi, and welcome to this video tutorial for allied health support. My name is Natalie Jack. I am a clinical supervisor, and today's tutorial is the first in a three-part series that I'm going to be doing about clinical supervision. So welcome again. Today what we're going to do is do a really brief overview of what is supervision, because we've all heard about it in the allied health professions that we should get supervision, we have to have supervision, but I'm wondering how many of us really know what supervision is, what good supervision is, and how to look for it and how to get what you need in terms of supervision. So today will be a bit of a supervision basics kind of tutorial, and the next two topics will be things like how to get the most out of your supervision, and also peer supervision, and also student supervision. So we'll do a bit of a series this year for allied health support around supervision. So a little bit about myself before we get started. My background is as a music therapist. I'm a registered music therapist and I have been since 1999 now. I've worked in various clinical populations with the majority of my time spent working in mental health, adult mental health. So mental health is something that's very important to me, my career especially, because that's what I enjoy doing with music therapy, and I think there's a lot of potential there for music therapy in mental health. So that's my background. Also, I have training and experience in clinical supervision, and that's something I've also become very passionate about. And my work now is actually providing clinical supervision in a private practice to allied health professionals from all types of disciplines, and it's something that I really feel very strongly about, and I love supporting professionals in that way. So that's a very brief snapshot of me. So the first thing for today, I guess, is what is supervision? What is this magical, mythical thing that we call supervision that everyone thinks they have to have but doesn't necessarily know about? Supervision is a professional relationship between two professionals, and we're going to talk about clinical supervision in this sense. Usually the supervisor is someone who is more experienced and the supervisee is someone who's less experienced. So you might have supervision from your manager at work, you might have external supervision, you might have different types of supervision that we will get into a little bit later. But essentially supervision is a supportive relationship from one professional to another. That relationship is for support, as I said, for celebrating the good things that happen in your practice, for exploring and checking in with the not so good things that are happening in your practice. Also, supervision is for accountability. It's for making sure that we as clinicians are providing good service, ethical service, and safe service to our clients. So at the end of the day, supervision is also about protecting our clients and making sure they are safe, being treated safely by safe and ethical health professionals. So that's essentially what supervision is. The I guess gold standard supervision is to get supervision from a supervisor who is external to your organisation. It's a little bit tricky if your boss is your supervisor, and that boss is also appraising you once a year and paying your wages and things like that. And then in supervision, we expect you to be completely honest and open with your boss and say, hey, I messed up. Would it be nice if we could all be very open with our bosses and have that relationship? But it's really not the ideal situation to have your supervisor as your manager or your boss as well. And look, in healthcare at the moment, who can afford to pay for all their staff to go and get external supervision? It's expensive. So the reality is a lot of managers are providing supervision. It's about how we can manage that situation. Anyway, supervision is intended to be an open and honest and trusting relationship, so that can take time to develop, like any relationship, personal or therapeutic relationship. And the idea is that the supervisee drives the process. The supervisee brings their agenda every month or every week, whenever it is, and they say, here are the issues that I'm facing, this is what I'd like to talk about, and these are my supervisory questions. So we try not to let supervision deteriorate into like a complaint session or a chat session. We really like to keep it a little more formalised and cover the things that are on the mind of the supervisee and make sure that they get everything covered that they'd like to cover. So supervision is driven by the supervisee, and the supervisor's role isn't necessarily just to tell the supervisee what to do, although that can have a place. Usually what the supervisor's role is to facilitate that supervisee to grow and develop and make their own suggestions and pathways and ways ways to solve their problems with some really good solutions. So the idea is a facilitative, supportive, strengths-based, in most cases, type of a role of the supervisor that really helps the supervisee to, as I said, do good work, be ethical, and actually look after themselves. So supervision is not about the client in the session necessarily. It's actually all about the staff member. We want to make sure that staff member and allied health professional is looking after themselves, has the right supports in place, they can reflect on their practice, and we're going to talk about that separately, and that they are actually all round doing well in their workplace. So supervision, if done really well, can prevent burnout, it can prevent high levels of staff turnover, it can create some really good clinical work, and it can make for really happy employees. So it seems, I know for a lot of employers, it seems expensive to allow staff to and pay for their supervision, but actually at the end of the day, it can be really cost saving for organisations. So that's essentially very briefly what supervision is. The next part I'd like to talk about is what supervision is not. So supervision is not teaching skills in the most part, and there is an exception which we'll talk about in a little time. It's not teaching skills. It's not telling them what to do. It's not solving everybody's problems or your supervisee's problems. And it's not just allowing the supervisee to complain. It's actually being active in helping them to solve those problems. So it's not about teaching the skills. You go to university, you go to your training courses and your PD to learn the basics of how to be your particular allied health discipline. However, if there are some advanced skills or some particular things you're wondering about, of course, your supervisor can give you tips about that, but it's not the sole purpose of supervision to teach you how to be an allied health professional. That's not the reason. The exception, and we will talk about it, as I said later, is if you're supervising students, there's an element of educational supervision in there. Also, if you're supervising new professionals, obviously they need a little bit of upskilling potentially, especially if they're in a new clinical area they haven't worked in before. And then the same thing goes for more experienced clinicians if they are in a new area as well. They might need some skills or just to be pointed in the right direction to where to get those new skills. So supervision is not education, essentially. And supervision also is not just solving people's problems, because if as supervisors and as experienced clinicians, if we are solving people's problems, they're never learning to solve their own problems. So it's not about the supervisor saying, okay, just go and do that, because that doesn't help anyone. The person goes, oh, I'm just going to ask them what to do next time. Then it's not actually teaching them to solve their own problems and think for themselves. So it's more of a facilitation. It's not a problem-solving kind of relationship. And what also it's not is it's not those other things that happen in a workplace. It's not organisational. For most of the time, it's not, oh, you've got to fill in this form for your pay, or, oh, there's this meeting we've got to talk about, or whatever. It's not that operational stuff that goes on in organisations. In an ideal world, those kind of conversations will happen separately. They will be those operational meetings that you have, the operational kind of discussions and things, get all those things out the way in a different environment. Supervision is it's more like, it's not therapy, but it's more like therapy in the way that it's kind of private and it's personal. It's about the supervisor. It's not about all that other stuff, the paperwork that has to happen in a job. So it's also not that organisational stuff. Okay, so if you find that you're going to what you're calling supervision and your boss or your manager or your supervisor is kind of giving you all that stuff, you kind of have to think, okay, is this actually meeting my needs of being somewhere I can go to talk through stuff and be open and actually get help with my profession and look after myself? That's actually what you might want to ask yourself in that situation. So the next snippet I want to talk about is something called reflective practice. And some of you might be all over it. You understand about reflective practice, but if you haven't heard of it before, simply reflective practice is thinking about your work. And I'm not talking about the type of reflective practice where you're awake at 3 a.m. and you're stressed about something that happened during the day. That's not effective or healthy for reflective practice. Reflective practice is really actually sitting down and thinking, or going for a walk and thinking, or doing your yoga, whatever it happens to be, and really thinking about what's happening in your work for you, for the client. Where are your challenges? Where are the things that you're going well? What kind of things you'd like to work on? How you're actually feeling about each client, how you're feeling about the work in general, what your goals are for the future. So that's reflective practice. You're actually reflecting deeply and honestly about your place within your work. So what is the meaning of the work for you? What are the benefits? What are the challenges? What are the things you love and you don't love so much about the work? And even down to those really kind of tiny things like, why did I say that to that client today? Why did I use those particular words in that way? What might that mean? And there's, all those types of things can then be brought to supervision. So if you're doing regular reflective practice, you will then create a list of things that you're going to take to your supervisor. So you do your reflective practice, then a couple of days before supervision, you sit down and write your agenda for your supervisor, so you've been thinking about your work over the last month or however long, and you have a list of things. You have this thing about, there was this particular situation with this client and I used these words, and look, I've been thinking about it, and my question is, I'd like to explore why I use those particular words. That could be a really good thing to bring up to your supervisor. That's just an example, but reflective practice is just so critical for all of us who are working with other people and who are working in therapeutic relationships. It's not as cut and dried as some other occupations. We're working with people's health, mental health, physical health, emotional health, and it's tough. And sometimes we need to just reflect back on how we're going, just to make sure that we're all on the same page and we're okay. We're looking after ourselves. So reflective practice is, I guess, that's the backbone of supervision for the supervisee, to make sure they are bringing the right things to supervision. Next, I think let's talk a little bit about the different types of supervision that are out there. Again, this is just a really brief overview, and of course there's lots more information out there if you need it. The types of supervision, as I said before, the gold standard, I guess, is this one-on-one supervision. So it's one-on-one, like a one-on-one therapeutic session or a one-on-one exercise physiology session. Same kind of thing, one-on-one. And the supervisee brings what they need to talk about and asks the supervisor questions. And if the supervisor is doing a really great job, they will let the supervisee talk and explore and kind of vent through all of their things, and then we'll guide them to what question do you have today, and what type of response would you like from me? What kind of help do you need today? And then the supervisor can facilitate that discussion and support and help them move through whatever the issue or issues are that they bring. So that's one-on-one supervision. It's a fairly standard type of way to do things. And a skilled supervisor can do some really great things in that kind of environment. The other way that I think is becoming more popular for supervision is group supervision, and this obviously in organisations that don't have a lot of money to be sending off everybody for their hour of individual supervision every month. Group supervision can be really good. Again, it takes a really, really skilled supervisor to be able to get everybody what they need in that session. So there's essentially two different ways you can run a group session. You can do a group session, say that you have the supervisor and you have, say, maybe 4 supervisees. And in the time that you have, you divide the time equally, and each person brings their own issue to the supervisor. And then the supervisor works with them in a one-on-one way, but within the group. So the other group members listen and they learn and they watch and they learn from the supervisor and they learn from the supervisee, but they don't input on anything that's said to that particular person who's being supervised at the time. So the supervisor and supervisee dyad, they finish their section, and then the next person brings their issue, and the other 3 listen and watch and learn. And at the end, you can have a discussion perhaps around how that was for everyone and kind of do some closure around that. So that's one way of doing group supervision. The other way is similar to that, where all 4 supervisees bring an issue to the group, and each has their turn in presenting their issue and getting feedback, although this time not just the supervisor does the supervision, the other members also are free to input on the situation and ask questions of the supervisee whose turn it is, and to perhaps suggest or guide or facilitate. So in that way, it's really beneficial because the supervisee gets the benefit of the wisdom and experience and the questions of not only the supervisor but also the other clinicians who are in the group, which, as we know, everybody has fantastic experiences and strengths, and if you can learn from each other in a group situation, that's also a really lovely way to go. So that is always negotiated between the group, whether they want to do it one way or the other way. It also might vary depending on what type of group you have. Do you have a closed group that is the same all the time, so that you create a relationship between all supervisees, and the supervisor? Is that something you're doing on an ongoing basis, or is the membership of the group changing each time? Those kind of logistics and the ways that the supervision is set up can always alter how you decide to go on with the supervision. So again, a skilled supervisor can do a really good job of helping people in a group situation, and it's a lot more financially viable in a lot of situations. So that's a good option. The peer supervision is the next one, and as I said, I'm going to be doing a short tutorial as well on peer supervision for allied health support. So peer supervision is interesting, and it is also becoming more popular again because it's essentially free if you have a peer that is an appropriate peer for you, who you believe you can have a good peer relationship with, and if you meet for 1 hour a fortnight, it doesn't, no one's paying anyone in that situation, whereas obviously in a group situation or a one-on-one situation, you're paying the supervisor for their professional services. So in peer supervision, it can be tricky because it's sometimes with a peer, it's hard to maintain the appropriate level of formality, shall we say. Sometimes it's easy to kind of get into comfortable mode and sit down and chat about your work and how you're going, and it can kind of get off track. So peer supervision, when it's done well, it's not formal, but it's structured. Everyone, each party, the two people both bring their agendas, and they both present their issues in the same way as you would with a supervisor-supervisee relationship. But you don't have that sense of that you've got a supervisor who's an expert and a supervisee who's coming for support. You have this peer, very even feeling of the two people together. So if you have the right person and you do it in the right way, peer supervision can be really, really fantastic for getting that professional support you need in either, the time that you need it or the financial way that you need it, if that is a consideration, which understandably it is in this day and age where not everybody's getting paid what they're really worth. So peer supervision, and we'll talk about that, as I said, in another workshop later on. The fourth type of supervision, I touched on it earlier, and that's the student supervision or intern supervision, depending on what kind of industry you're working in. Now, student supervision, and again, I'm going to do an online tutorial about this. It's different again because you actually have a responsibility to teach the student how to become whatever discipline it is. I remember, especially from my experience, it's great to go to uni and hear all the theory about hear all the theory about music therapy and, this is what it needs to be a music therapist, and you take all that theory in, but it's not until you actually go on placement and you learn from an actual clinician how to be a music therapist. I learned how to be a music therapist on those days when I was on placement. So a clinical supervisor in a placement and an education setting is a really important person, and the techniques that you're using are different and the outcome is different. You're actually looking for skills to be developed. You're actually looking for people to learn and get to a certain level of skill before you can kind of tick them off and say, yes, you're good, I'm happy to send you out into the workforce, to work with patients and clients. So student supervision is a slightly different beast, but the same principles apply. We want the student to be bringing their agenda. We want them to be reflecting on their practice. We want to be building them up and showing them support. We want to be facilitating their own abilities to solve problems and to think through things. And we want to, really encourage their ability to come openly and truthfully to supervision, because those kind of skills, not easy for everyone, but so important to have for long-term life in the allied health profession. So a lot of the principles are similar for student supervision, and when I supervise students, I set them up the same way as I would, and I add those extra elements of education. And of course, you do need to assess the students at the end of the placement. So we add those things in. But what I always say to my students is, look, try not to worry about the assessment, because this is actually about you becoming a therapist. This is actually about you becoming one of the people that you're striving to be. So let's, and be open and honest about all that, providing feedback midway, all the time actually, midway through the placement especially, so that the students know how they need to improve, and combining those things together. And again, it's a skill, it's a real skill for the supervisor to be able to do both of those things, just as it's a real skill for a manager to be able to do both, to be able to have operational discussions with a supervisee, but then also provide them with that really honest, non-judgmental supervision, clinical supervision. So there's the different types of supervision. It's a quick overview. Some of the types of things that we can talk about in supervision, let's talk about that. And we'll talk about the boundaries of kind of supervision and then personal counselling, because that's also an important aspect of knowing when to refer people on and where the line is there. So the types of things you can bring to supervision, as I said, all kinds of clinical problems. It could be something from, I used this technique with this patient or client and it really didn't work very well. And I'm wondering if we could just kind of go through that and discuss where I went wrong or what I could have done differently next time, because I've been thinking about that. So that's one thing that you can bring to supervision. Another thing could be, I had this client the other day and I've been reflecting on the feeling that I had when I was with this particular person. I felt this, this really strong feeling and it reminded me of this other thing. I'm wondering, my supervisory question is, I'm wondering whether we can talk about that and I can explain a bit about where that comes from for me and you can help me move on, and because I want to do my best work. I don't want these feelings to be, to changing the way I work with this person. So there's those type of things. So as you can see, it's to do with the client experience and the client exchange, but it's to do with you as a therapist and looking after your own well-being and your ability to work well and effectively with your clients. So there's those types of things. There's other things like professional issues. We had this meeting the other day and this other particular staff member, colleague of mine, said this thing and it really upset me, and I really would like to talk to her about it, but I don't know how to do that. Can you give me some ideas? Can we talk through, maybe role play some ideas on working with this particular professional? So it's also about professional issues, workplace issues, things like that you come across. Other things always that are common in my professional supervision practice is confidence. Things like, I want to do this thing, but I'm not sure if I can, or I'm able to, maybe presenting at a conference or going for a new job, a promotion. I don't know what to do here. So all those things are kind of global things about yourself as a practitioner, your confidence, your ability to communicate well. I do all kinds of work around that, and even still now, especially with things like the NDIS coming in, people are revisiting those old skills that we learnt. How do you write a SMART goal? How do you write a goal so that the NDIS is going to recognise your service and fund your client if that's what they want? So the landscape of supervision is kind of changing, and it changes depending on what funding is happening, what political things are going on at the time, and what policies are and things like that. So other things you can bring to supervision are anything to do with your professional life. So say you've got a business, you run a small business, and you want to talk about how to promote that business, or how to use social media well, or how to communicate really well with a certain client base, or how to do that. And that kind of edges towards your, business mentoring. But in my experience, it really still comes into supervision, because you're talking about all kinds of things, confidence as a business owner, confidence as a clinician, how to get those skills, how to integrate. And this is something I talk about a lot in my supervision work, how to integrate your therapist side, the caring side, that you want to, help your clients and patients. But the other side of you, that has to be the business side. I've got to charge, how much do I charge? Or can I really charge for people when they don't show up? I feel bad. Balancing those two aspects of yourself as a clinician, a caring clinician, and as a business owner. So when you're in different phases of your career, you'll have different needs. So anything to do with your work is, as far as I'm concerned, is fair game to put on your agenda and bring to supervision. If you're an employee working for an organisation, a hospital or a community organisation, you're going to have different needs to if you are a business owner, if you're a allied health professional and business owner. So those things that you will bring, the issues you have, are going to be different when you bring them to supervision. The line that we need to take as supervisors and supervisees really, is when is an issue a personal issue and not for supervision? When is it something that you actually need to go and see a counsellor or another type of therapist for if it's a personal issue? And I'll give you a couple of examples. Someone might say, and they come to you and they say, I don't know what I'm going to do, I can't go to work. And then the supervisor's response would be, oh dear, what's happening for you? Is there something wrong in the workplace? And the person might say, supervisee might say, no, I'm going through a relationship breakup and I just can't function without crying. And you go, okay. And then it's the supervisor's job to say, where's that personal line and where's the professional line? So obviously the relationship breakup and the reasons for that and all of that personal stuff and what they're going to do about it, that's not for supervision. That's a personal thing. And the first thing you need to say is, hope you've got some personal support there, and can I refer you to a counsellor or something like that. However, this personal issue is affecting her ability or his ability to go to work. So that is where the supervisor can step in and say, okay, and being very open about where that line is for you. Anything that affects work and how it affects work and strategies to kind of fix that problem, that's where supervision is good. So I won't ever say to someone, no, don't tell me that personal thing, because if it's affecting work, then that's fair game. If you can't go to work because of some personal issue, that's my job as a supervisor to help support you to do that, to get back to work, because that's obviously very important for more reasons than just money. So there is a line, and we can't be as professional supervisors solving everybody's personal problems, because that's not the role of supervisor and supervisee. But as far as it affects your work, personal issues sometimes do come up, and again, it's the skilled ability of the supervisor to balance that and to be a human being and obviously care about people who are going through personal problems, but to also really do their job well in helping and supporting that person to be effective at work. And sometimes that might be, maybe you need to see your GP and get a month off or something, and maybe that's the advice sometimes, but it's about knowing where that line is and balancing those two things, and not just brushing it off and saying, oh, that's a personal problem, we can't talk about that, because that's not appropriate either. We still need to be human beings. So yeah, there's so many different things in supervision that we can do and work on. The very last thing I'd like to talk about today is one particular model of supervision that I use from time to time in my practice, and it's called the seven-eyed model. So it was created or developed, I guess, in the mid-80s by authors Hawkins and Showett, and you can Google that and you'll find the seven-eyed model. And it's about looking at a supervisee's particular issue through seven eyes, and I like to kind of call them lenses as well. It's about looking at the problem from different perspectives and different points of views, and in their model they call it the eyes, seven eyes. So the first eye is through the client. Like we were talking about earlier, it might be a particular client interaction we're talking about, and so the way we look at the problem and investigate it is through the eyes of the client, and then talk about the issue in that particular, from that viewpoint and from that lens. The second one is to look at the issue in terms of your interventions, and this interventions could mean clinical interventions, or it could mean business practices. What did you do? An intervention is something you do, so what did you do in that situation? Let's look at the actions and the reactions that happened in that situation to kind of tease out what went on there. The third way, and this is a very popular, I guess, common way to look at things, is to do with the client-therapist relationship. Let's look at this situation from the view of the relationship. Who was doing what in that relationship, and what were the feelings, and what were those interactions like, and what do we think was going on in the client-therapist relationship? That's another way to look at a particular problem. Another way is to look at the therapist and their process. What were their feelings? What was their experience of that interaction? What was their thoughts and emotions, and how was that for them in that particular situation, and how can we use that knowledge to then think about a solution? Other ways, which I guess I don't want to say more advanced, but more in-depth, are what is going on with the supervisee-supervisor relationship. In that, is there a parallel process going on? Is there something going on with the supervisor-supervisee relationship that's actually being paralleled in the clinical space? Or the opposite way around, is there something going on with the client-therapist relationship that is then being parodied, I guess, or paralleled in the supervisee-supervisor relationship? So that's another kind of level of thinking that can go on. And again, the second last one is the supervisor and their process. It's very important for supervisors to reflect too, and to get supervision on their supervision. So that's something that we all do, hopefully, as skilled supervisors, is actually get supervision on our supervision. So then we can reflect back on that and, what was going on for the supervisor? Is there a parallel process between the supervisor and the supervisee, and then the supervisee and their client? Or there's all kinds of ways to look at it from the supervisor's perspective to gain insight into what the next steps might be, or some discussion around that. The last one is the wider context, and I guess the wider context, even though it's the seventh eye of the seven-eye model, it's actually one that's really good to look at, is stepping back from the situation, trying to gain some objectivity, which is obviously tricky when you're in the situation, but the supervisor can help to take a step back, take the therapist and the supervisee on a step back and look at the broader context. What is that? What does that mean for the organisation, perhaps, that you're working with? Or what does that mean for your business? What does that mean for the community? What might this issue reflect on the policies and processes that are going on in the workplace? Or what does this mean in the greater community of funding bodies and regulating bodies, things like that. So taking a really big step back and looking at the big picture and the wider picture of things. So that's just one particular model. There are many, many, many models, just like in therapy, of different ways you can do supervision. And, my main message today is that a skilled supervisor can really see what the supervisee needs and guide them towards that. So that's everything I have for you today in this very quick half-hour tutorial. I hope you've enjoyed learning a really brief snippet about what supervision is. If you have any more questions about supervision, obviously Google is your friend and you can Google all kinds of things. My website is nataliejack.com, and if you ever have any questions or you want to have a chat, you can always contact me there. I'm always available. I'm also on social media, so you can find me there. And I'm always really, really happy to talk about supervision, developing supervision teams, all those kind of things that really support our clinicians to be the best they can be, and then to do a really good job with their clients as well. So thank you for listening. Thank you for having me, Allied Health Support, and I really look forward to providing a couple more in a series of supervision later on this year. Bye for now.